Hey Alex, how are you doing today?
I'm doing pretty good.
Why are you in?
Well, I've been feeling pretty depressed and empty, and I feel there's no in between with people. There's just a lot of good people and bad people, and I've also been pretty angry and hostile, and I don't know if that's a good trait, or I don't think that's very healthy. I don't know what I want in life, and I'm constantly bored and getting agitated, and sometimes I consider suicide for attention, and I get paranoid very often because of it.
Well, looking at your information from what you just told me, I think you may have borderline personality disorder.
What is that? Can you tell me more about it?
Actually, I could. I have a lot of patients that come in with that disorder. Basically, it's characterized by persuasive pattern of instability, most evident in relationships, mood, and sense of identity.
Okay, that makes sense. What are the characteristics of it?
Well, people with borderline personality disorder often experience a distinct kind of depression that is characterized by feelings of emptiness and negative emotions. They rarely go as far as to harass people, but they are affected by interpersonal incidents that most other people would let pass.
Okay.
People with this disorder experience a phenomenon called splitting. You know what that is?
No.
Well, it's basically when people form sudden, intense, demanding relationships with other people and perceive other people as being either all good or all bad.
Okay.
Yeah, so experiences of distress and rage reoccur because of the inappropriate intensity of their relationships. Anger and hostility are enduring characteristics found in many people with disorder. Now, going along with having disturbed relationships, people with borderline personality disorder are confused about their identity or their concept of who they are. After questioning their identity in adolescence, they are unsure of what they want out of life and lack a firm grasp of their sense of self. It can be expressed in sudden shifts in life choices. They also have chronic feelings of boredom that cause them to seek stimulation, such as promiscuity, careless spending, reckless driving, binge eating, substance abuse, and shoplifting. Have you ever experienced any of these?
Well, I've experienced the promiscuity and the substance abuse part, but I don't feel comfortable yet discussing that. Could you please continue?
People with borderline personality disorder have moods that are as unstable as their behavior. Their extremes of feelings may be put in a state of suicidal thinking and self-injurious behavior. It is considered as a gesture to get attention from someone close, and it's called parasuicide. Sometimes people just do it to test if they are alive. Suicide is pretty high in borderline personality disorder.
Oh, great. That's wonderful news.
Guess that's not a fun fact. I'm sorry, I'm just trying to help you and tell you the facts.
I know.
Okay, well, moving on. Individuals are intensely angry most of the time. A common trigger for their rage is feeling that they have been neglected or abandoned by a lover or another important person. Stress is also a pretty big problem with it. During a stressful experience, their vulnerability intensifies, causing them to be paranoid. That's probably why you've been feeling paranoid lately. You've been stressed out? Okay. Well, they also may develop dissociative symptoms such as feeling disconnected from others and even from their conscious self. There's a term that characterizes the range of emotional disturbances, and it's called emotional dysregulation, which is a lack of awareness, understanding, or acceptance of emotions, an inability to control the intensity or duration of emotions, an unwillingness to experience emotional distress as an aspect of pursuing goals, and an inability to engage in goal-directed behaviors when experiencing distress. Don't get freaked out. People with this disorder can manage responsibilities of day-to-day life, but sometimes the demands of their lives may become overwhelming and they might experience a transient psychotic-like stage, possibly characterized by delusion of thinking or maybe dissociative symptoms, in which then going to the hospital might be necessary.
Wow. So what's the prevalence to this disorder?
The prevalence for this disorder is probably about 2% for the general population.
What causes it?
Well, there's a lot of things that cause borderline personality disorder. From the biological perspective, the hippocampus is about 16% smaller than normal, and the amygdala is about 8% smaller. And from the psychological perspective, 3 variables have emerged as compelling predictors, which are disturbed childhood family environment, parental psychopathology, and childhood abuse, which is the main one. Also, there's Linhan's diathesis stress model, which says that people are biologically predispositioned to be emotionally overreactive, that their emotions are not validated by the family, they overreact, get emotions noticed, and extreme emotions are reinforced, not normal emotions. So whenever they react harshly, they get attention from it, and so they continue to do it, just keep getting the attention, not from their normal emotions though. And lastly, from the sociocultural perspective, people with borderline personality disorder are vulnerable to the diminished cohesion in society that is associated with urbanization and modernization in contemporary culture. They have instability within society and a lack of clearly defined cultural norms and expectations. And another reason is instability within their family.
Okay. Wow, that's crazy. What are some of the treatments for it?
Well, there's a number of them. They have a lot of therapies. Some are supportive or confrontative therapies, and that's when the therapist tries to avoid their client from feeling anger or helplessness, and goals such as improvement in relationships and reduction in symptoms are formulated. And the client discusses their inner thoughts, problems in function, and anticipated behavior. Also, the most compelling therapeutic approach for treatment is dialectical behavior therapy.
What exactly is that?
Well, it integrates supportive and cognitive behavioral treatments to reduce the frequency of self-destructive acts and to improve the client's ability to handle disturbing emotions such as anger and dependence. Basically, the therapist's strategy is to alternate between accepting the clients as they are and confronting their disturbing emotions to help them change.
Okay, well, it makes me feel better that I can get help. Thank you for your time.
Oh, it's no problem. Come back anytime you want. You have a great day.
Thank you.